Hello, everyone, and welcome to another episode of Medicare Industry Insider. I'm Chalen Jackson,
I'm Rachel Brameyer.
and we are live this time from Washington, D.C. at the National Association of Benefits and Insurance Professionals Capitol Conference here in D.C., talking to legislators, working with other members of NABIP to get the message across that the insurance and healthcare industry is primed for change and working to make positive changes in the lives of our beneficiaries. So we want to talk a little bit about the event that we have been at for the past 3 days, go over the look and feel, some of the talking points that we took to the Hill, what the process of lobbying and advocating looks like, and give you a few takeaways and how you can get involved in the process.
But first and foremost, I think the important thing, we want to paint a picture of what it's like to be a part of NABIP, to be a part of Capitol Conference. And I think it's important to talk through just the impact of DC, what it feels like coming here, what it's like to be at the nation's capital. This is my first time here, so it's definitely, I had no idea what to expect. But coming in, we did get a chance to do a monument tour, and it was a night tour, and it was amazing. It kind of brings you back to the pride of your country, realizing how big the United States is, all the history that's involved, the impact that some of the leaders have had in our past, and it's just amazing. But you've been here a couple times, so how does it feel like coming back again?
It's a lot of fun, Rachel. I really enjoy DC. Last year was my first year out at Capitol Conference, and I tell this story to everybody because it was really impactful to me. For some reason, it's the only time I've ever flown in that direction, but we came in from the north into Reagan and flew kind of, as we were coming in, the plane went down the Potomac, and as we started banking in to land, you see out the window of the plane flying over Arlington National Cemetery, Pentagon in the background, the monuments start popping up outside the window, and you can't help but have a sense that it's going to be an amazing experience. There is something really, really breathtaking about being at the seat of politics here in the U.S. and knowing that you're going to be working with some really good people to get the message across that we are here to improve healthcare for millions of Americans.
Wow. I think you told me about that story too, and then I was hoping for a window seat and didn't quite get it. So I think my experience with my wow moment since I've been here was going to the Lincoln Memorial.
Yeah.
And it's just, one, it was nighttime, so everything was lit up, but walking up the steps and then walking into this beautiful statue of Lincoln sitting, and the vaulted high ceilings, the columns on either side of them. It almost is an emotional experience when you walk up there because it's so impactful. It almost felt like going to Rome, where there was 2,000 years of history, but it's only 200. So it was kind of, I guess, 150 if it's Lincoln. But just the impact that these influential people have had on our country, and us getting to come to this conference and meet with people that can make changes and can be a part of a change basically for our healthcare and our industry. So I think as you come, if you do come to NABIP, if you come to DC in general, make sure to take some time to go visit, go see some sites. We did see the Bill of Rights, we saw the Constitution, and that was also pretty neat just to see the history of where our country came from too. So take some time to go visit everything, really get the feel and soak it in when you're here. So let's talk a little bit about the event itself. So now that we're in DC, we're checking into a hotel, and the very first day you're gonna end up coming into a conference room that's also very large, and meeting tons of people that you've probably seen in the past at different events, or maybe even competition, maybe friends. But everyone is here basically for the same reason of being interested in what's going on in the government, how can I make a difference, and being overly passionate about just making sure that our seniors, that our healthcare in general in the United States is where we want it to be. So that was kind of neat just to see the type of people that were here. Everyone cared. I think that was the biggest impact that I felt when we were here.
Yeah, I would agree. I think I tell people constantly that if I could only do one event a year, Capitol Conference is where I would be, because it is just such a different energy in the room to have people that are engaged in the political process, interested in the solutions to some of the problems in our healthcare systems. And I would really encourage, it was so amazing this year, specifically because we had a year where attendance was up, which is not abnormal. It's an election year. Those are always really well-attended conferences. But we were almost 20% of attendees were first-time attendees. So, like you said, you may see folks that you run into at other events that you know from the industry that you're around there. But even if you don't know anyone, this is a really great event to come to. I think it is such an incredible learning experience. You're going to get to hear from some amazing industry speakers talking about health tech, talking about regulatory guidelines, talking about some of the ways that the industry is shifting and moving and the direction it's going. The speakers are fantastic. We had some really good panel discussions and presentations on various aspects of healthcare, including Medicare and long-term care and cost containment and group plans, how to manage drug costs and self-funded plans. There's a lot of different things going on in the healthcare industry, and we have the people that have their finger on the pulse speaking to us at this event and getting us ready to share some of the solutions that we as an association, as NABIP, have come up with to really help move things in the right direction. And I think we've got some really good talking points that we've put together on a couple key things. We're not trying to solve every problem all at once, but a couple key things that could make big impacts for a lot of the beneficiaries that they work with.
So when we were getting ready to go to the Hill, one of the things that the event itself did was break down the talking points that NABIP had. So it was actually part of the main stage, basically going over like some of the things that NABIP is passionate about, that all the insurance professionals will be talking to people on the Hill about. It was broken down into 3 main topics. We're going to go more in depth on the 2 that more pertain to Medicare, since this podcast is all about Medicare. But the first one was basically preserving and strengthening employer-sponsored health coverage. Basically, the biggest takeaway with this was making sure that employers were not getting penalized with taxes that basically were on demands that were unnecessary, specifically about personal health information, about having to gather detailed information that if they didn't have everything, they get penalized and it shouldn't be an employer's responsibility. There are a couple other things on the health side, but on the group health side that we went over, if you do want to have more detailed conversation about that, you're welcome. If that's a side that you're passionate about, or maybe that's a side that you do the ACA or the small or large group side, we're happy to go into that because we definitely learned a lot about it. But being that this is Medicare Industry Insider, we'll go a little bit more in depth than the other 2. And they were addressing the cost of care and overall just Medicare. The Medicare one, we didn't actually have any Senate or House bills that were in place, but it was more educational for the House and Senate representatives, just to be aware of what was going on so that they're ready to go. But I'll let Chalen kind of dive into addressing the cost of care.
Yeah, absolutely, Rachel. I think it's really important to note that there's so much crossover in our industry. So even when we talk about something like reducing paperwork burdens for reporting requirements for group plans, that's things that still trickle into Medicare and can impact Medicare beneficiaries, whether it is that ACA 1095 reporting, or whether it is creditable coverage requirements. A lot of these things bleed over and still affect Medicare beneficiaries. But in terms of addressing cost of care, we actually had a couple really key points this year that are directly tied to Medicare. One of them being site-neutral payments. This has been a big issue the past few years that we have been working on and pushing, working on the Lower Cost and More Transparency Act, House Resolution 5378, and working to help ensure that beneficiaries are paying the same rates for services regardless of where they are receiving those services. So making sure that that outpatient clinic is not charging unnecessary hospital facility fees just because it happens to be owned by the same entity, making sure that folks are getting a fair shake on their healthcare costs, and particularly in the Medicare side, focused a lot on Part B administered drugs, making sure that they are not being overcharged for going to a hospital-owned outpatient clinic compared to getting it at their physician's office. So luckily that House resolution, thanks to the work of many of our representatives and the advocacy of NABIP and other groups, we did get H.R. 5378 passed back in December through the House. So the fight now is to get that into the Senate and adopted into law there. We've also had a lot of really good movement on how people can make better informed decisions. Right now, there are a lot of challenges and struggles in the employer space to get access to healthcare claims data that can help them inform decisions on how they buy healthcare for their employees and how they report some of this data to the government. So there have been some significant movements on the Healthcare Price Transparency Act 2.0, which is Senate 3548, and trying to get employers the ability, which they are currently prohibited from, to use some of that de-identified health data to make those purchasing decisions in a more responsible way that can help lower costs for their employees and help make healthcare more accessible for those same people.
To continue on, this was, like I said, we had 3 big bullet points, but lots of sub-bullet points. So this is still a sub-bullet point of part of the cost of care. But another one is the NABIP is supporting a permanent expansion of telehealth flexibilities. This is Telehealth Expansion Act of 2023. There's actually 2 bills. There's the HR 1843 and S1001. Both of these, so they're in the Senate and the House. Both of these are being addressed mainly because the what was initially passed is going to be ending in 2024 unless action is taken. So essentially, the biggest thing is basically that currently legislative action taken basically during the pandemic allows HSAs, their qualified health deduction health plans, HDHPS, to cover telehealth services before reaching the deductible. So basically allowing people to use telehealth if they have a high deductible plan to help with any care. They can call their doctor and not have to wait for the deductible to be reached. Well, this is expiring at the end of this year, and there's been so many good things about telehealth. I know Chalen and I have talked about in many podcasts about telehealth, pros and cons of it. But one of the big things is basically just making sure they're not discriminating against, rural people who maybe don't have the bandwidth. But they've done a lot of studies of like virtual versus, just telephone conversations and pros and cons. And even if someone can't virtually meet, the difference between the two of them are not substantial. So hopefully all of that will continue on with research, education, making sure that people are aware that this is actually helping a lot of people by having the ability to do telehealth, and that it extends with the Telehealth Expansion Act of 2023.
Absolutely, and I think there are so many good things going on in that. I really think this is going to be an easy win that allows that better access, going to help folks with those high deductible plans access care a lot more easily and efficiently. And even with our Medicare population, we're going to go into the Medicare talking points in a half a second, but even with the Medicare access, telehealth has been such a good tool for so many beneficiaries that it has given them such better access, especially for routine and mundane things, checkups, things like that. It just is so much easier than getting out of the house, safer than getting out of the house for some of those folks if you're a fall risk, if you have issues getting around, mobility restrictions. But NABIP has got some really big talking points on the Medicare side this year. Obviously, there's always a lot of regulation and changes coming to Medicare year after year, and this year being no exception. NABIP does have some really strong talking points on the TPMO and burdensome marketing restrictions that have come down over the past few years, working heavily with CMS to try to make some reasonable adjustments to ensure that bad actors in the space are rooted out and dealt with appropriately by CMS, but leaving good agents alone to do the work that they do in their communities with beneficiaries and making sure that the Medicare beneficiaries in their area are taken care of. So definitely talking a lot about the definition of TPMO, third-party marketing organizations, how that might be tweaked to exclude brokers and agents, changing some of the marketing regulations, concerns over privacy and data security with call recordings and the 10-year maintenance requirement. There are a lot of things within those marketing regs that pose some issues and problems, and while we don't yet have any legislation on the books to address that, we continue to lobby both of Congress and with regulators to make some reasonable common sense changes that make it easier for agents to do business, easier for them to make an impact in their community, and easier to help seniors and Medicare beneficiaries get accessible and affordable care. And lastly, on these talking points that I want to talk about is, as we go into the rulemaking season for 2024, there are some major changes proposed in the rule this year for the agent and FMO compensation models, and NABIP does oppose the changes that CMS has put forward. It would certainly drastically affect beneficiaries. And again, I want to be clear when we talk about a lot of these talking points, and we'll dig into this more when we talk about going to the Hill, but we use a lot of beneficiary-centered language when talking about these points, because at the end of the day, CMS's initiative, their call to action, is to take care of Medicare beneficiaries. So making sure that they understand from the beneficiary perspective what it means to not have access to an agent they trust and can work with in a way that suits their needs, whether that's face-to-face, over the phone, virtually, or teleconferencing. Having access to that licensed, trained, certified agent is so critical for their healthcare success. So opposing limitations that would reduce access to licensed and certified agents, opposing services being removed from those agents by changing the compensation structure, has been a big talking point this year. And it's great to have these talking points, but we've got to do something with them. So after getting together as a big group, having some sessions, learning about these talking points, sharing the value of what we're doing with our membership that have come to the Capitol to make a difference, then we all break off into our little groups, state by state, and go to the Hill.
So the hotel that we stayed in was only like a 5-10 minute walk from the Capitol. So it was actually very breathtaking. As you're walking, you're getting closer and closer to this Capitol and feeling the impact of like, okay, I'm getting ready to meet with people who need to be informed, ask questions, know that we're resources if they do have additional questions on healthcare, and at least bring these 3 talking points in front of them to make sure they understand the importance. They're aware of all the bills that are and acts available that they can kind of reference if they're wanting more detailed information. So we're walking over, and all these representatives are actually not in the Capitol, which was new to me because, I just, in my head, I thought everyone just worked out of the Capitol. There are tons of buildings near the Capitol that house all the House of Representatives, the Senate, and all their staffers. So as you're walking, one of the first things that I was new to was the security.
Yeah.
So as you walk up, you're standing in line, getting ready to basically go through airport security. And depending on how many people are visiting with different representatives, the line could be very quick and easy, and sometimes it can take a while. But making sure that you get there in time to kind of get through security. Another thing that I didn't realize was that a lot of the buildings are all connected through underground tunnels, which makes sense for, cold winters in DC, but also for the security reason too. So
Sure.
A lot of walking when you get there. But I'll kind of go through what it felt like to kind of walk in and what the process of talking to someone looks like. And then your experience, Chalen, because this is year 2, you can go into that also.
Yeah, I think, Rachel, one of the biggest things that a lot of people maybe don't realize is that when we talk about going to the Hill, I think a lot of people think of the Capitol, and while it is the backdrop for most of DC, A lot of people are a little surprised when we show up at a much smaller administrative building, either the Rayburn building or the Longworth building, depending on who you're meeting with, which is where the actual House and Senate offices are. So typically not going to the actual Capitol building, but those attached buildings where we can meet with staffers, meet with legislators, and get these important points across. And yeah, being a second timer, it was great to kind of see the buildings again and get over to the Hill. And I think it's been so important to me to get more involved in that process every year we do this, because it is such an opportunity to get in front of legislators and their staffers. And I think that's a caveat I would add to this, is very oftentimes you are meeting with congressional staff, not with your representative or senator. And sometimes you can get those meetings. It depends on the relationship. And we've worked really hard to develop a lot of those relationships over the years, and have had great meetings with, Ann Wagner, Eric Burleson, Josh Hawley, Eric Schmidt, several of the folks, in certain times when they can make time for us. But at the end of the day, as much as we love to meet with those senators and representatives, their staffers tend to be the ones that can enact change a little bit quicker, because that's who's developing proposals, advising the representatives and senators on policy decisions. They're the ones that are going to do the research, put the package together, and help that representative make educated decisions on some of these major policy issues. So I think setting that stage for people so that they, because it would be easy if you're a first timer to be a little frustrated that you're not actually meeting with your representative or senator or whomever you thought you might be meeting with. And I think if you don't have set proper expectations, some people can be a little confused and discouraged by that. I don't know what your experience, Rachel, was. I hope I prepped you a little better than that, but that has been something I've seen in the past. But understanding the process better definitely makes going to the Hill a very valuable experience.
Yeah, and I think I did get a good prep from a couple of people like Dan Mangus and Chalen also to walk me through that it wasn't actually going to be the House or Senate representative. It would be their staffer or their administrative person. I got the pleasure of meeting with 5 of them. It is another thing you do have to do is pre-register who all is coming, and a lot of times sending detailed information prior to even meeting. So there's a lot of prep work that goes into actually attending these meetings. But once you show up, you have a designated person that you're supposed to be meeting with, and you are usually about 30 minutes of their time. So when you get there, it's, a little bit of chit chat, but down to business. It was interesting that some of the staffers had done a ton of research and, had all the prep work, and they remembered seeing what it was, and then others maybe not so much.
Sure.
So, it is a numbers game, it's about getting in front of people who are willing and wanting to listen and hear. And sometimes you'll run into people who oppose what we are going up against, or maybe don't quite understand it and maybe are willing to listen too. So it is interesting that just providing yourself as a resource for them to be educated and learn more, I think, is a really big takeaway when you're there. Even if they don't understand 100% of what you're saying, we do live in a world of acronyms and the separate language almost with the world of insurance. So making sure that they, are not talking over their heads, and that they're able to feel comfortable to ask questions or reach out afterwards. So one of my big takeaways afterwards, I'll probably be sending a thank you note or a thank you email to them, and at least providing my information for a resource if they have more questions and want to reach out.
Absolutely. And I think asking really good questions is just as important as sharing information on these visits. We met with a longtime congressional staffer that we've done work with in the past, and a well-beloved in their district representative that's actually retiring at the end of this term. And, with them up for retirement, there was, maybe not the reception we received in the past in terms of a desire to be really active and starting something new. But what we did get away from that meeting was some really good access to some committee staffers, maybe not related to that particular office, but related to the issues. And, sometimes meeting with those committee staffers, meeting with, not just the representative, but all of the other inner workings of the Capitol can also be really, really valuable process. I was fortunate enough to join several other NABIP members with the Medicare Advisory Group that I'm a part of, to meet with the House Ways and Means Committee staffers to go over some of these changes, particularly regarding the upcoming Medicare regulations. So we were able to get in the room with some key staffers that can help enact real change, trying to get to folks that we can actually make a difference with. So it's not always the actual representative staff or Senate staff. Sometimes it's committee staff. And I think the more you get involved with this, the more you learn the intricacies of how policy decisions are made and learn a little bit more about finding the right person to talk to. I think that's the biggest thing. So what I got away as a takeaway this year, and what I hope most people came away with, is that we're making some big changes. We've got a very energized group of members going into this year, and some big changes we would like to see made in the healthcare industry. And we had a lot of good people on the Hill this year, meeting with representatives, getting the message across, being a unified voice for the organization, National Association of Benefits and Insurance Professionals. And I think NABIP did a really good job this year of creating a strong message to get across to those legislators as we were up on the Hill. I think it was a great year for advocacy. I think we made some really good connections, and I know I've already gotten a couple emails back from staffers to set up follow-up calls. But the big thing is things can't end here. I definitely want to talk a little bit about that, but I want to get any of Rachel's takeaways first. Otherwise, I'll ramble all day.
That's what we do though, right? We just ramble.
Yeah.
No, I think for a first timer coming, it was I came in kind of with no expectations because I didn't want to be disappointed, or I didn't want to be, I don't know. So I think part of it was I got prepped a little bit with meeting with staffers, not the actual Senate or House of Republican representative. If I hadn't have been prepped, I may have been a little disappointed, I think. One thing that I didn't expect was that I'm very passionate about this. I love what I do. I love this industry. I love healthcare. And to be a little frustrated that not everyone was as passionate as I was when we were going through those meetings. But I got very pleasantly surprised that some of them were. Some of them had, as we were going through bills, I had one person I talked to that was a staffer of someone who was on he was a co-chair of the Ways and Means Committee and had actually helped create and pass some of the legislative works that we had talked about on our talking points. And he got really passionate. He stood up, he started pointing to a map and talking about, a study they had done where they had met with different hospitals and did some surveys and things like that. So it was just so refreshing to see that some of them had not only done research, but been on the ground floor creating some of the legislative work that we're passionate about. So I think I got pleasantly surprised that some of them were very passionate like I was, and then a little disappointed when they weren't. But that's a numbers game. That's how, we're all in sales. And I think that goes back to, not everyone's going to be as interested as you are on everything. So I think that was a big takeaway. In terms of the event in general, I was pleasantly surprised just how everyone was here for a purpose, and that was educating themselves and being part of the change and learning more so that they can become better advisors. So I loved that. I think the quality of people here, everyone cared. They took a lot of time out of their own day. I mean, it was a 4 or 5 day event, so it's definitely a marathon, not a sprint when you're here. It's a lot of networking, a lot of meeting people that maybe have been on different boards and different chairs, and making sure that you're finding the right connections and getting the right information. So I think for me, the big takeaway was just, it was a phenomenal event. It was something that I hope I can come back again, because it was something where you do feel like you're making a difference when you leave. So if that's something that you're passionate about, of not only being an educated advisor, but also being on the ground floor of any sort of changes, or basically getting in front of Congress about major talking points that are going to affect your clients and your industry, this might be an event that you'd be interested in going to. But also there's a lot of ways that you can get involved on a more local level too. Both of us have held positions on local level, and Chalen recently on bigger level. So I'll let Chalen kind of talk about some of the positions that you can potentially look at joining and being a part of.
Absolutely. It is so important to get involved. And I guess the first thing I would tell anybody is don't wait for next year's Capitol Conference, which, please note, always at the end of February. So that last week of February, mark your calendar, plan to be in DC with us. But don't wait for next February to get involved. There is some of the best opportunity we have to enact change is getting together with those representatives and senators while they're in district, maybe during the fall recess, maybe working with district coordinators to do events or studies or public opinions, or even just meeting with them there in their district with their constituency. And I think that's a big takeaway that a lot of people should have is the work doesn't stop when you get back on the plane. The work still continues back in district and working with the constituents of these representatives. So there's going to be a lot of follow-up, a lot of work to do when we get back to Missouri to continue this conversation with those folks as we go throughout the year and into this fall. But yeah, you should absolutely look at ways to get involved, anywhere from your local chapter all the way up to national roles. I started out just as a member and quickly rolled into chapter leadership there in central Missouri, taking on a couple different roles as chairs of different committees, chapter president, and then now as the president of the Missouri Association, and serving nationally on the Medicare Advisory Group. It has been a wonderful experience to be able to get involved, drive policy change, help set the tone for some of these talking points and for some of the issues that we've decided to take up, decided to maybe pass on. It has been really valuable to me personally to be able to get involved in that way, and also really, really impressive to see the wide breadth of people that show up to an event like this, just really engaged, being really intentional about the change they want to see in this industry. So definitely recommend anybody can get involved, anyone can get involved at any time of year.
And I love that you said the wide breadth of people, because that was another thing that I also noticed. You're looking at, carrier reps. A lot of them are presidents of their local chapters. You're looking at some of them that are just local reps. Some of them are all the way up to like the national level who showed up here. You've got FMOs representing representatives here. You've got large SGAs, FMOs. You've got all the way down to agents who run their own agency. Maybe some of them have staff, some of them don't. There's just so many different types of people that were here, but they all had one purpose, which was educating themselves, educating our Congress that they were going to go visit, and basically just making sure that they were in the top of the knowledge of what was going on, what we care about, what we don't, what acts are currently in process of being approved or voted on. So I think it was just kind of neat to see the different types of people here. It was all across the board of healthcare, so that was neat to be a part of. And then, like Chalen said, I've been very involved on the local level for probably 6 years now. Different positions on the board that I've held. I've helped get speakers. I've done different things like that. So even if you are interested in moving all the way up, like Chalen has raised on national levels, there's a lot of ways that you can be very involved in your community, your local community, and also connect and network with a lot of your local Congress people, whether it's in your state or get a chance to go to your state capitol and meet with those people, because every year NABIP does do a day at the Capitol. Depending on what state you're in, it's a different time of the year, but you do get to meet with your local reps, and that's kind of neat to see as well. So the purpose of going to the local meetings varies a lot by where you're at and kind of what the main goals are, but essentially it's all education and bettering you as an individual and as an advisor. So speakers are going to range across the board. Some of them are going to be more related to under 65 group health, some might be PNC, some might be Medicare, so you'll get a good taste of different types of interest in the healthcare industry and in the insurance industry in general, and then you may get a chance to talk to attorneys and different advisors. Maybe they're motivational speakers. There's all sorts of different types of topics that you run into when you go to these events. So definitely recommend to get involved. There's a lot of different ways you can do it, but essentially the end goal is educating yourself, being an advisor, knowing what main things are being looked at in Congress that do affect our industry, and making sure that you're continuing on with how it affects your end goal, what you're trying to do. And if you want to be involved and you want to make changes, this might be a good organization for you.
Absolutely. And I will leave everybody with this. If you do want to get involved more actively in the industry and in advocating for ourselves, our businesses, and our clients, highly recommend you go to NABIP, NABIP.org. That is the association website where you can find these talking points, where you can find information on how to get involved, look up your local chapter, your state chapter, upcoming events, and find everything you need to make that jump and get engaged in changing this industry. So I think there's a lot of opportunity in the coming years to make a huge impact in how healthcare is delivered in this country and how we as agents and brokers can lead that change. And I hope that this has been a valuable episode live from Washington, D.C. at the 2024 NABIP Capitol Conference. And with that, we'll leave you all until the next episode.